So the confusion that I've seen as the CEO and as a dentist provider myself is the gray area of what is urgent care.
Right.
Right? Emerge is pretty obvious. You wake up, you got that throbbing toothache. You're gonna either go to the emergency room or you're gonna go to dental office, right? And
Right.
preference always be to go to the dental office first because that's where they know how to treat dental pain. Um, so anyway, that's obvious. When you get into the urgent care, that's where, as clinicians and as our industry, we've had to have a conversation. What is urgent care? The American Dental Association came out with their guidelines, and we're subscribing to their guidelines, which seemed very reasonable. That basically was any problem that you're experiencing or that we see as your provider that we feel or you feel in the next 90 days, if it were to go untreated, could turn into a real emergent situation. To either become very painful or just become a lot more intense of a procedure if it were to be delayed. An example is, let's say you looked in your mouth and you saw a big hole in your tooth. Either a filling came out or you just had a cavity you never noticed, but
Right.
it's visibly apparent to you. Um, we would tell you, and it's not hurting yet, we would tell you there's a really good chance if you do nothing about that in 90 days, it might start hurting, it might abscess, you could get a swelling. So you've gone from needing a filling to now either needing an extraction or a root canal and a crown on that tooth. So not only does that potential become very painful, it has the potential to become very expensive.
Right.
So what we're setting up, or what we've set up, is we have a call center that anybody can call in if they want some counsel on what would be urgent care. So that's a really excellent example because there's a lot of gray area in that example you just shared.
Right.
Some was scheduled for a crown at the end of next month, which I'm assuming you mean May.
Yeah.
So we're hoping by May that, according right now, it sounds like we could be back in business in May, right? And so that person will be able to keep that particular appointment. For some reason, if things changed and our shelter in and our restrictions were pushed out further into June, we would need to make a we need to evaluate the situation and talk to the patient and go over the benefit risk factors. So if a tooth has been root canals, and this is what we would talk to on the phone, a tooth has been root canaled and the crown is broken, so that root canal is no longer sealed. That root canal, which is very expensive to have done and not an experience anybody wants to have done twice if they
Right.
can help, right? That root canal is potentially getting contaminated. It's no longer sealed. And so that patient is at risk of having to have the root canal redone. They're at risk of an infection going down into their jaw. Pardon me, going down into their jaw. So there's a lot of risk factors in that particular situation where most likely in that situation, we would not want them to delay that treatment. Yeah, Kaiser's a little unique because it's an HMO, right? And they normally require you to go to their providers. But what happens if their providers are not open,
Right.
um, or they don't have one in your area? And I've had Kaiser before, so speaking from a personal experience, when I needed a treatment and they didn't have a provider in house, I was allowed to go outside of their group and have my treatment done. So in this case, I would be really surprised if Kaiser specifically doesn't have some emergent dental care available for their patients, their customers. But if they do not, they would have to allow them to go outside of that. We have a lot of patients that don't have insurance at all, and so we have a $49, if you want to call it a COVID emergency special right now,
Yeah.
where we really don't want finances to be a hurdle. We know a lot of people are out of work.
Mhm.
And so we have a reduced emergency exam fee right now. You can come in, we can take an x ray, we can assess it, and we can tell you if you need the treatment now or if you can delay that for 90 days. So we're very fortunate that we kind of saw this coming and we had more than sufficient supply to maintain our normal operations for the next 6 months. And then with the restrictions that were imposed, we had, a significant amount of overabundance of some of our PPEs. And because our, employees are part of the communities that they live in, a lot of them have spouses or friends or family that work in, other medical care facilities where there's a greater need.
Right.
It's been able to be brought to our attention of who is in the greatest need of these PPEs, these personal protection equipment that we're able to share. And so we're pretty proud. A lot of our employees that have been laid off, doctors and hygienists, they've been taking this excess of PPEs we have and volunteering and personally delivering them to different emergency rooms.
Wow.
To the tune of 50,000 surgical masks we've been able to share with our community medical partnerships. In times of crisis, it's about everybody coming together as partners in this, right?
Mm-hmm.
And we feel very good that we're able to be a part of this medical community and not only help keep thousands of patients out of the emergency rooms, which is the worst place you could go right now if you had dental pain.
Right.
To go to the emergency room, period, right now.
Right.
But especially for a painful tooth. So our goal is to keep those patients, and this is the goal of the whole Washington State Dental Association as well as the ADA, is to do our part to keep patients out of the emergency rooms, but to be able to help support the emergency rooms by, what we're not going to use, be able to give to them so that they can use, because they're in critical need, as we all know. If you have any question, if you should be going into the dental office, having any pain, any discomfort, you're seeing anything that's alarming to you, call us. We'll tell you if you need to come in or not. And that's, I guess, our number one message is call us before you go to emergency room. 75%, 80% now of patients that are in call their dental office might find that their dental office is closed. Don't assume that all are closed. Smiles Dental, Optima Dental Spa, we're open. Give us a call, and this is not a plug for us, but we really are here as a resource to the community. Give us a call before you end up going to an emergency room.